My name is Megan Green. I am with A Step Ahead Chattanooga, and I'm going to be making some announcements to you throughout the day, so I wanted to introduce myself. Our first session here, of course, is patient-centered counseling through the PATH framework. I'd like to introduce you to our first speaker, Patty Cason. Patty is a family nurse practitioner, trainer, educator with a specialty in sexual and reproductive health. She has practiced for 38 years in a wide variety of clinical and academic settings and is a contracted consultant to training agencies, nonprofits, and state departments of health across the United States. The PATH framework for person-centered reproductive goals and contraception counseling, and she and her colleagues, who I will let her introduce, are sure to provide an informative presentation today. Thank you, Patty. Welcome.
Thank you so much for that lovely introduction. Are you able to see the slides?
Yes.
Okay, great. So I'm going to kick us off, and I wanted to explain, first of all, that I'm doing this with a very dear colleague, Jolie Pritzker. Jolie and I met when we were talking about contraception counseling and how to do that in a patient-centered way a few years ago. And since then, she's joined me in being extremely excited about the PATH framework, and she's helped in many ways to bring it forward into the type of framework that it is today. It's really gone through a lot of various iterations over time. She's a family nurse practitioner, as am I, and she works at an FQHC in San Diego. She is also a consultant and a trainer for the National Clinical Training Center for Family Planning. And she has a lot of expertise in general in patient-centered care, and specifically as it relates to contraception counseling, and lots of experience with placing and removing both IUDs and implants, as well as teaching and training on those. So Jolie's going to kick us off in a second, but until then, we're going to, I think that Jolie, are you there yet? Okay, so we're gonna go ahead and get started. Here are my disclosures. I do have a relationship with Sabella, which has got 2 IUDs in development, and I am a trainer for Merck for Nexplanon. Jolie has no disclosures. Here are our broad learning objectives, and we really feel like it's important to address reproductive goals with people of all genders, all sexual orientation, basically anybody. And so this whole framework is designed to be able to engage with folks wherever they are and be able to center them in the questions that we ask them, and to be able to skillfully and efficiently then have a conversation with them with using all the wonderful counseling skills we all use all the time anyway. There is a specific word, and that word is plan, and that word actually becomes problematic sometimes when you talk to people about their reproductive desires, so we're going to talk about that a little bit too. So first of all, if we were in a room together, I'd ask you, what's the goal of reproductive health counseling? If you just think about that for a minute, I think that people come up with a whole variety of things that they would say get them up in the morning, and things that they think are really, good morning, Jolie.
Hi, sorry about that.
No, it's not you. It's we've been having some platform things. So what is the goal? Is it to help clients clarify what they want? I would say, what do you think, Jolie?
I would say absolutely. I think that's
yes.
Really first and foremost.
I'm not sure if you're, I'm not able to hear you very loudly. Maybe potentially others can we
get it? Yeah.
Hey, Patty, this is Megan. Sorry to interrupt. Apparently, your video is showing me, or, well, no, I'm sorry. They're saying your video isn't showing up. They want you to share your video.
Yeah, I know.
Well.
I'm having technical problems with
Okay, I can see your screen share.
Yeah, and Jolie, are you able, can we hear you now?
Can you hear me better now?
I can't. Can you folks hear her pretty well? I can't hear her very well.
No.
Okay, I'm just going to continue until Jolie gets louder and we get my video figured out, which we haven't figured out yet. So it's definitely to facilitate a discussion and to help someone clarify what's important to them, so that they can make decisions that are really in line with what is important to them. And providing relevant information.
How is my audio now when I jump in?
It's very quiet. So how we ask the questions affects how they answer. So we develop these questions specifically so that someone who's answering the questions would have the ability to answer in the way that's the most meaningful to them. So if we essentially lead the witness with asking a question in such a way that it would kind of lead the person to a particular type of answer, we haven't really gotten down to what's most important to that person. So we really do try with this framework to have a very open-ended question and then have that question focused on a particular aspect, especially their reproductive health in this case. So I mentioned not using the word plan, and why would that be? It seems like for years we were all talking about we want to encourage planned pregnancy and discourage unplanned pregnancy, and that was a very important goal for us for very many years. We started to find out early with some earlier data, but most recently just in the last 5-10 years with Abigail Aiken and Christine Dellendorf, and most importantly for this work, Sonia Barrero, who looked at having surveys with qualitative research with folks in low-income communities about the acceptability, essentially what came out to be the acceptability of pregnancy. And the reason we say acceptability is that's kind of what she found out, is that people decide whether or not to have a baby based on whether or not it is acceptable to them at that time. And it really has virtually nothing to do with whether or not it was planned. The planning certainly does help if you're so inclined, and that's what you have the ability, resources, the time, the partner to go ahead and plan. It's a wonderful thing. There's nothing wrong with it. But the thing is that it doesn't apply to many people. So it can be limiting, especially, and actually inappropriate, especially among low-income populations. And it's also potentially triggering. You're having a conversation with somebody and they may get the clear sense that you think that they should be planning, and therefore they're going to give you the answers that you would like, which is that they are not currently planning a pregnancy. So the thing is, though, you could be not currently planning a pregnancy and then express happiness with the pregnancy, even if you had no intention of being pregnant. Jolie, can you?
All right, how is my audio now?
Yay, your audio is wonderful.
Oh,
And
good.
I'm going to finish this slide, and then Jolie's going to take over for a little while. A pregnancy does not need to be planned to be healthy. We need to be super clear about that and underline that several times. It's definitely great for somebody to be on folic acid, to have had some preconception care, and that's a lot of what the PATH framework is about, is bringing somebody to that preconception care that would help them to have a healthy pregnancy. And the way we do that is for those clients that we're interacting with, bring about the understanding that there is actually pre-pregnancy care that's appropriate to them, relevant to them at that moment in their life, even if they are not planning a pregnancy. Take it away.
All right, so this just highlights, and I just want to confirm, not just Patty, can other people hear me much better now? If we can get like someone in the chat to just say yes before. Great, excellent. All right, so like Patty just mentioned, pregnancy planning it has a particular meaning. It means it's a very deliberate act that is usually between two partners where there's a conversation, there's a consensus that's reached about the timing of the pregnancy, and then you take these concrete steps. Like, in some of the studies that Patty mentioned, it might be getting your finances in order or getting married. And again, sometimes that is relevant for our clients, but it's not necessarily required to have a healthy pregnancy. And so we really want to shift the conversation away from, was this pregnancy planned or not planned? Are you planning a pregnancy, not planning a pregnancy, towards sort of a broader assessment of someone's reproductive goals, so that then we can provide relevant information. Next slide, please. Patty, are you able to advance the slide? I think there we go. So this is just a quote from I believe from the Sonia Barrero article, that few, if any, actually achieved either the relationship or the financial stability that they knew was sort of expected. And so therefore planning their pregnancy really seemed irrelevant and didn't really happen. And so how do we reach those clients? How do we meet them where they're at? And so really kind of this comes back to the idea of what needs to be the focus of our counseling conversations to help people achieve their own reproductive desires. And, I would, really it comes back to that shared decision making. How do we engage in a two-way conversation with a client? Next slide, please. So really what we're bringing to the table as providers, as health educators, as, kind of different, support staff that work in the clinic is, we are bringing sort of the medical and scientific information. We are, sort of helping to clarify a patient's goals and preferences. And then what the patient or the client's bringing to the conversation are their values, their preferences, their goals, their past experiences. And I think that this slide really, it's important to take a minute to integrate kind of what's on this slide, because what we are not bringing to the table as the healthcare professionals are our values or our preferences or our goals or our past experiences into that conversation. That's not that we don't have those things, but ideally we check them as much as possible at the door so that we can really focus on the person that's in front of us to help them clarify for themselves what are their goals and preferences. And we'll spend a little bit of time later in this presentation talking about how do we provide information like the scientific and medical information in a way that's both relevant. I think that's a key one. Patty referenced that already. And that also can be assimilated and integrated by the patient. We can provide lots of information, but if they're not able to really either understand it or we're moving too fast and they're not able to really kind of take it all in, then we haven't really provided information that's useful for them. Next slide, please. So before we jump into the path questions themselves, I just wanted to throw this out there as kind of a point of self-reflection before we start talking about the path framework and different counseling skills. And this clinical scenario might feel familiar for a lot of us, but you have a client who's coming in for a visit, and over the course you ask the path questions that we're going to talk about, and they share that they want to have children at some point, but not anytime soon, and that it's pretty important for them to not get pregnant. You find out that they've been using withdrawal for pregnancy prevention. And, you provide lots, you talk about their goals and preferences. And at the end of the visit, they still want to be using withdrawal as their primary method. And so I just want to sort of have you take, quick 5-second pause to think about what feelings come up for you as a provider or a health educator, whoever, if you're interacting with this client, because I think that it's very easy. Well, I'm going to pause for a minute to let you kind of think about it. I like kind of taking a minute to think about it, because I think a lot of us feel like it is our job to help people pick the most effective method. Or if there's some incongruence that somebody really doesn't want to be pregnant, and based on their own goals and preferences, they're using a quote unquote less effective method, I think that we can sometimes feel like it is our job to kind of make sure that they kind of pick a certain method, or we kind of are leading them towards a particular outcome. And really what the path framework does is it helps us move away from that towards a much more kind of patient-centered care model. So the path questions, which I love talking about, as Patty mentioned. So really there are 3 questions that sort of that move off of each other. So the opening question, when you want to get a sense of where someone's at, is, do you think you might like to have children if somebody doesn't have any kids, or more children at some point? And Patty, I'm able to see the folders that you're opening, just as a note. And really, if you don't know if somebody has kids, you can always start by asking, do you have any kids? And then if they say yes or no, you can adjust the first question. So do you think you might like to have children at some point, or do you think you might like to have more children at some point? Depending on how they answer that question, you might then go to a timing-based question. When do you think that might be, if they don't tell you that already? And then if somebody has expressed that they sort of want pregnancy but not anytime soon, the last question, and we'll go through this all in more detail, sort of would be how important is it for you to prevent pregnancy until then? Sorry, one second. like I had something come into my come into my ear. Are you guys hearing some weird audio? Okay,
I
that's
wasn't.
fine. Okay, not a problem. So the next couple slides that we'll move through quickly are examples of the job aids that that are available. They're linked below. They're linked through the Envision website as well as to the Family Planning National Training Center. These are really great resources, especially if you decide that you want to try and kind of use this in your clinical practice. It really lays it out very nicely of where you go based, a nice little algorithm of where you go based on sort of how someone answers the question. We're going to talk a little bit about how there's nuance to it. It's not just a boom, 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 but these are really great resources. So the next couple slides, Patty can click through to show the different examples. This one's the workflow. I believe the next one is the back of it, which has different counseling skills. And then there's a palm card as well, like a smaller one. That's a really great, that kind of lays it out. And so those are all, I believe, linked below.
And just one point that these are all also in Spanish, and we did very recently have a whole team of folks go through them and make sure that all of the translations were as accurate as we can possibly have, given that we live in a culture with many, many, many different types of Spanish being spoken.
Yes. Yeah. Thank you for reminding me of that. So this is just a different way of thinking about what we've talked about, which is really sort of when we're having these conversations with our clients, the goal is to, kind of clarify kind of what their motivations are, and also to assess sort of that degree of acceptability regarding pregnancy, because it really is a spectrum. It's usually not always as cut and dry as, yes, I'm actively trying for pregnancy. No, I want to use the most effective method possible. That there's a big range in there. The kind of, sometimes it's if it happens, it happens, or we're not trying, but I'd be happy if I got pregnant. All of that sort of is relevant so that we can then offer appropriate interventions, which might be preconception care, it might be contraceptive counseling, or it might be referrals for infertility services or adoption, as we'll see kind of some examples coming up of how that plays out. And the reason one of the reasons, there are many reasons why I love the PATH framework, but one of them is because it is language that can be used for like all our clients. And so it doesn't matter if they are a teenager or somebody in their 40s who's kind of addressing their fertility. It can be used with like all genders, any sexual orientations, and it doesn't stigmatize people who are struggling with infertility. When I do trainings kind of for providers, sometimes they get people share that they feel example of if they have a trans client, of how to talk about these goals. And the great thing about PATH is that it's the same language for everybody. You don't have to change your language if you're talking to somebody who's non-binary or somebody who's with a same-sex partner. And so that's what I think is really great. It's the same for everybody, and so it gives us those tools and those skills to feel really comfortable in having these conversations with everyone who's coming into our clinic. So this is just kind of coming back to those PATH questions. And, a big part of asking these questions is how do people respond when we ask them? So it's obviously, we're in a world right now of a lot of telehealth, which it makes it a little bit more complicated sometimes, but body language or sort of the tone of someone's voice when they are sharing kind of a response of what they think about, having kids is huge. If somebody, when you ask, do you think you might like to have children at some point, and they have a big smile on their face and they're, sort of really, sort of excited about it, that tells you something, versus somebody who says, well, maybe at some point. That's really going to give you a lot of information. Next slide, please. And so when you ask that first question, do you think you might like to have children or more children at some point? And they answer kind of, they say yes, or that they're open to it. Sort of, you are probably going to then go to this question, unless they told you, oh, yes, but not until I'm 30 or not until I finish school. That's different. But if they say, yeah, I would like to have children at some point. And you would then go to this question of, when do you think that might be? And I really want to highlight, when you ask this timing-based question, it is not about finding out that they don't want to get pregnant for 3 years, so you should offer the 3-year IUD. or they're thinking about, getting pregnant in a year, so then we should use different methods. It's not for that reason. It's to help the client figure out for themselves kind of what that time frame looks like. And sometimes people answer in very concrete terms. They'll say, oh, I want to wait 6 months and then we're going to start trying. But oftentimes it'll be more of an event-based response. I want to finish school. I want to wait till my partner's back. I want to sort of feel more, I want to get my first job. Whatever that answer is. And so the beauty of the when do you think that might be question is it allows the client to determine for themselves kind of what that is. So actually, Patty, are you available to kind of, do the back and forth with me on this one? I think Patty's muted for now. So we'll go. So this I would like you to be
okay. I'm happy to.
Sounds good. So if I were the provider and, we're in the middle of a visit and the conversation segues to asking about their reproductive goals, I might ask, Cherie, do you think you might like to have children at some point?
Yes, absolutely. I'm pretty traditional and family is one of the most important things in my life, but I want to be married first. And I really don't see that happening anytime soon.
Thank you, Patty. So this is an example of you ask that first question and you actually get the first question and the timing-based question all wrapped up in one. They've let you know that they definitely want to have kids, but they've also shared that it's really not anytime soon. I was going to take a quick pause because I don't think I mentioned at the very beginning, this first question that do you think you might like to have children at some point? It is different than a lot of ways that we often ask about sort of pregnancy and sort of reproductive health goals, in that we're asking about parenting. We are not asking about pregnancy. And I think that that's a really important distinction to make with the PATH framework, is that most people don't get pregnant just for the sake of getting pregnant. They get pregnant with the idea, like if they get pregnant sort of with sort of some intention, it's to start a family. And so, I think that I just wanted to highlight that as something that it's not asking about, do you think you'd like to be pregnant anytime soon? It's asking, do you think you might like to have children at some point? Were you wanting to hop in there on that, Patty, to give further thoughts on that?
Well, no, I was going to say that I was going to actually address this next one, so I'll wait.
Okay.
I was just going to say for this next one, the reason that we have Carla Valdez's citation here is that she did a wonderful PhD study and looked at essentially how did people answer this question, how important is it to you? And in terms of the timing of that, this is how it sort of shook out, was about a third of the time each of these things happen in your mind. A third of people will consider that a timing-based question is about a life event, and about a third of the time a timing, and about a third of the time both combined together. And then 10% was just random.
Yes. And what's helpful too is that you really want to, when you're having this conversation with a client, when they answer that timing-based question and they tell you whether it's, like in this case, until they're out of school for the next 5 years, until your partner gets back, you then use that as this last question when you're assessing kind of for a lack of a better term, how acceptable kind of pregnancy would be for them. How important is it for you to prevent pregnancy until, and in the framework it says until then, but really that's a placeholder for you to then say until you're out of school for the next 5 years, until your partner gets back. And that is kind of that facilitated listening, that the client really feels like you've heard what they've said, so that then you can sort of incorporate it to make it clear that you've heard what they shared. And so this is just different answers of how to individualize the question. How important is it for you until your partner gets back for the next 5 years? All that. And so this is just kind of reiterating the idea that if they indicate that, so you ask, when do you think that might be? And the answer indicates no time soon. It's really important to ask this last question. Sometimes people like they can feel that they can skip over it right to then jumping into asking about contraception. But the how important question is really one of the cruxes of the PATH framework. I can't tell you how many times I use this in practice, and I'll ask the first question and they say, yes, I want children at some point, not anytime soon. And so then you think, okay, let's jump right to the contraception question, or asking about contraception maybe. And then I ask this last question, how important is it for you? And they're sort of like, well, it's kind of important, but if I were to get pregnant, I'd be okay with that too. And that's a very different conversation potentially, because you might be offering some sort of, basic sort of preconception care as well, especially if they're using one of the lesser effective methods. So you really, it sometimes feels like we can skip over this last question, but I'm going to really encourage you, if you try out this path framework, to make sure you're incorporating this last question.
And there is a lot of recent data looking at these kinds of questions and coming up with the idea that how important concept is a critical piece of the whole thing. And just for exactly the reasons you're outlining, Jolie.
And then sometimes you ask this question and you'll get a response that the timing is now. They are, actively trying for pregnancy currently, or they are imminently wanting to sort of, seek pregnancy. And then it provides this beautiful segue into talking about being prepared for a healthy pregnancy. And so the next couple slides just have some examples of kind of how that flow might happen. And so we might say, do you think that you might like to have, more children? Let's say somebody already has a kid, more children at some point. And they say, yes, we've actually been trying for a while. And you might sort of be able to sort of follow up with, so would you like to discuss ways to be prepared for a healthy pregnancy? Or maybe if they've shared that it's been taking a while, that they've been really trying for a while, it's been a year, you might ask sort of, are there other, what questions can I answer for you about pregnancy, about sort of, about getting pregnant? So it also makes it very easy to tailor the conversation quickly to what somebody needs. We can't make any assumptions about where someone's at in their kind of reproductive journey, and we want to make sure we're offering that relevant information. We don't want to be jump right into birth control with somebody who's actually seeking pregnancy with their partner. And I think that this is also sort of, I don't know about you all, but where I work, if it happens, it happens, or some variation on that. When you ask about sort of how important is it for you to prevent pregnancy, is really a very common question. And I think gets to kind of the nuance and the complexity of sort of how people feel about parenting, about pregnancy. And so this is often a great to ask, would you like, always asking for permission to discuss ways to be prepared for a healthy pregnancy? And that, it's great because it meets them where they're at. And maybe it's something as simple as saying, hey, if you know that you were to get pregnant and you would feel fine with that, let's get a prenatal vitamin on board to get that folic acid there, so that if you were to get pregnant, sort of you're already taking that. Or let's talk about some of the medications that you're on, so that we could maybe switch them to some that would be better to use during pregnancy, so that if they were to get pregnant, they're off to a really good start. And so that's sort of different, it's a different mindset around kind of how we address this ambivalence that comes up. Now, sometimes, especially I find with younger clients, it comes up sometimes where you'll say, would you like to discuss ways to be prepared for a healthy pregnancy? And that's actually really clarifying for them, because they're like, well, no, I don't really actually want to be pregnant right now, but I just, and then you get into a different conversation. So again, it allows kind of for a broad range of different responses from our clients.
The to be prepared part is, it's an attempt to have the entire process be more passive. In general, we obviously want to encourage any type of autonomy with our patients, any way in which they can take control of their own care, their own lives, and just have us help. But in this instance, we're sort of encouraging passivity. We're sort of encouraging, you don't have to be seeking, you don't have to be planning, intending, just be ready. Have the sort of the soil ready in case a seed were to fall from wherever seeds fall from, and be able to have a healthy pregnancy.
And so, yeah, this is a similar idea. And there's also, I believe it's linked in kind of with our other job aids too. This is a really great preconception counseling checklist. So, especially like for, sometimes for people who are more family medicine providers and maybe they don't sort of do the reproductive stuff isn't something they do all the time. There's sometimes, well, what do I do? Like if somebody is trying, what do I have to cover? And this is a really great sort of checklist to have in your back pocket, or I use it all the time, even though I do this work all the time, because it's just a really nice reference point to make sure you hit the most important things as far as helping people be prepared. And so let's say, so we just talked a little bit about if somebody has answered the questions in a way that indicate that you really should be offering preconception counseling. Let's say they answer the questions in a way where they make it very clear that they are not wanting to sort of have children anytime soon, and it's very important for them to not get pregnant. So then you might offer, would you like to talk about kind of contraception options, different birth control methods? And this is kind of, this question is what I love to lead with when you're kind of, before you jump into talking about specific methods. We as providers love talking about the methods, but we can sometimes spend quite a bit of time talking about methods that might not be relevant for our patients. And so asking somebody from the get-go, do you have a sense of what's important to you in your birth control? Or if that language, sometimes I think Patty, you've shared that kind of in certain parts of the country, like certain parts of the South, asking someone if do you have any sense can be a little bit off-putting. So the next slide has an alternative, which is, can you tell me something that's important to you in your birth control? Both get at the idea of asking somebody to clarify for themselves, sort of what's important. Occasionally and sometimes people will answer this kind of, without missing a beat. I want something that doesn't have hormones. I want something to make my periods lighter. I want something that works really well. Occasionally, just in case you encounter someone where you ask this question and it lands a little bit flat, they look at you like they're not totally sure what you mean by it. Especially this is for people who've maybe never used birth control before. You can always offer different ideas. Some people want their periods to get lighter. Some people want something that'll help with their skin. You can kind of offer some different common things that people will often say. That's
a really important caveat, Jolie, is that when you're using the PATH framework, one of the things that's important to do is to practice it in the beginning, just to really just practice the questions verbatim. That's what the job aids are for. You probably already have a lot of language that works really, really well. And it's not that we want to supplant all of the wonderful counseling that you're doing. But if you give the questions a try verbatim, just asking them exactly the way that they are, you actually have the ability to let the open-ended, focused questions do their beauty and have the conversation get as clear as possibly directed pretty quickly towards the patient's, essentially what it is that's important to them and what do they want. And I think that if you do that, I just want to point out you've saved a lot of time. So asking a question like this, asking the PATH questions, the PATH reproductive goals questions, all of this, while it is extremely focused on being patient-centered, is very efficient. Because as Jolie's saying, if you start to talk about methods with this client before you've actually gotten into a pretty thorough understanding of what is and isn't acceptable and what is something that somebody's looking for, then you've spoken about methods that are irrelevant. And how is that helping anybody in that context? The other thing I was going to say is we have an abridged version in case you wanted to put the PATH questions in your EHR. You could just ask, would you like to have, do you think you might like to have children anytime soon? And if they already have a child, do you think you might like to have more children anytime soon? And it's just a sort of a one sentence screener. And then depending on the answer, you can go directly into the rest of the PATH questions.
Yeah, and I'll say really quickly, part of why I got in, why PATH really resonated for me and wow, now I feel super passionately about it, is that like what Patty said, it's this very efficient way of getting sort of patient, of keeping the conversation very patient-centered while also getting a lot of relevant information to move the visit forward. And it has also, it has brought a lot of joy to my practice because I see how clients respond to it. And I think that many of us, when we go into this work, we are doing it because we love that interaction with our patients. And as we have a lot of time constraints, clinics are super, fast-paced and busy. And so how can we kind of find ways in our own practice to connect with the things that make us happy about being providers. And at least for myself, in incorporating this into my clinical practice, that has been been one of the benefits of it for me, beyond just kind of, I think it's great for our
And it's funny
clients, too.
because we talk about wanting to ask the questions exactly as they are, which sounds scripted, but it's almost the reverse. It's almost like the script that's the diving board off of which you can dive into a pool of extremely, these conversations are unique. They're really, hopefully, conversations focused on what the patient wants, what the patient needs. And so it's both.
100%. And so before we talk about sort of, in just a minute, Patty's going to talk a little bit more about kind of some specific counseling kind of skills and a technique that we can use once we dive into more of the kind of information part of a visit. But just to highlight a few things from what we just covered, that really part of this, some of the key takeaways is that we want to avoid those plan-based questions for all the reasons that we talked about. We also want to use those open-ended timeframes, like at some point, or when do you think that might be, when we're asking about a timing-based question, to really allow it to be defined by the client and not by our time frame as a provider. The last question: how important is it to you to get to prevent pregnancy, or to prevent or to not get pregnant until sort of, instead of for you? And it's a subtle distinction, but the to you really centers the person. It's not coming from an external place of what do they think is right for me, like by some outside force, but really to me, like as a individual.
Yeah, because you could say to somebody, how important is it for you to prevent pregnancy? And they may think, rightly, that you're asking, has your rheumatologist told you that you mustn't get pregnant? Has somebody told you that it's not a good time? So it's more, that sounds more objective. How important is it for you? So we really want to center it on how important is it to you, that particular human.
Exactly. And then lastly, sort of when we're asking that contraception question, that best contraception question, we really are asking what's important to you, not what's most important to you. We often go to that sort of, it's something that when you see people using the language, they'll say, well, what's most important to you? And we don't want to lead with what's most important. We want to just it should be a buffet for the client. They can pick as many things as they want. And there might not be a method that checks all the boxes, but we at least want to start with, okay, this is what somebody wants, and how can we narrow it down for them to offer the methods that are relevant for them based on what's important to them. And that could be multiple,
and it will be multiple different things. And if they happen to give you 3 things that they're looking for and they can get them all in one method, it never matters what's most important. But if they say they'd like something that can treat their acne that has no hormones, they'd have to tell you which one of those 2 is most important, because you can't have both. So we're going to get into counseling skills by calling the counseling skills an information sandwich. So everything we're going to be talking about from now on has to do with this sandwich that you're looking at. And Jolie found this sandwich. Jolie, did you take a picture of a sandwich that you made?
I didn't, but I found a picture of a sandwich.
I would want to eat that sandwich. So the idea is, with a sandwich, right, there's 2 pieces of bread or something like bread, and there's something in the middle. So the first piece of bread is acknowledgement. So you've asked somebody one of the questions that we've just outlined for you, and they've given you a response. And now what's the next step? How do you respond to their answer, essentially? Or perhaps they've given you some misinformation. They've said something to you that you're fairly sure is misinformation, and you have the correct information and you'd like to share it with them. So maybe you need to clarify something. Or maybe you're now at the point in the conversation where they've said something that's been difficult for them in one way or another. So before you respond with any information or content or even paraphrasing, acknowledgement is the first step. So that's in order to build rapport. It's in order to facilitate the rest of the conversation, the subsequent parts of the conversation being flowing easily. So the first step before you dive in is just a brief moment, and sometimes it is maybe a couple of seconds to acknowledge something. And we're going to talk about how you do that. And then the middle part of the sandwich is the information or the content, or perhaps it's a clarification. So maybe it's information that you thought you realize the person doesn't have and is very relevant to them in terms of the decision that they're going to make that day. So maybe it's information, maybe it's just that you're clarifying something that was misinformation. And also, really importantly, sometimes the middle content of this is just reflecting back to somebody what you've heard. And that's a skill all unto itself called paraphrasing. And then the final piece, I know you're wondering what the last piece of bread is for, because you've already done all the content. The follow-up question is super important. You ask a follow-up question so that you can help the person that you've just given this information to or shared this content with. You've given them the opportunity to now integrate what you've just told them by asking them a follow-up question. So what does that look like? First of all, acknowledgement. So acknowledgement is, as I said, the first step. And the way you can think of an acknowledgement is to start with something positive in whatever situation that is, something positive. And that something could be agreement. Let's say they said, I definitely don't want to use anything that will stop me from getting my period because my grandmother always told me it's really super important for me to get my period. It's not healthy if I don't get my period. So you could say, oh no, your grandmother's wrong. Never a good idea. I'm sure everybody knows that. Or you could say your grandmother's absolutely right that when you're not using hormones in your contraception, you do need to get your period regularly. Find something to agree with. If the person has expressed anything that is a feeling, an emotion, then have your first acknowledgement be a little bit of empathy. Wow, I can see how that'd be really hard to deal with. Just a second, or sometimes just wow, and pause. And then if you don't have anything to agree with and you don't have anything to empathize with because they have not said anything emotional, you can always validate. And I want to say, any one of these things has to be genuine. You need to find something to truly respect in that person in that moment, or none of this works. This is not about lying to your patient. This isn't the hamburger method that you've probably heard of, where you give somebody some positive feedback and then you criticize or give them negative feedback and then you give them some positive feedback. It's not that. This is actually, you find something truly to agree with or to empathize with. But if you haven't gotten anything to empathize with or to agree with, you can always say, I hear that all the time, or I can totally understand why you would think that, especially if you're going to be correcting, essentially. And then the other thing to always want to be on the lookout for is a positive that's strength-based, something like a health supporting behavior. The person has managed to negotiate with their partner after having had chlamydia 3 times in the last year to consistently be using condoms. And that's a real win for that person. So that's something to point out. And then if the person has said something that has some misinformation in it, and I would hesitate not to call it a myth because I don't think anybody really wants to believe in a myth. I think they'd like to believe that when they believe something, it's based on correct information. So that's why it's really important to start with something positive. And in this case, it's all the same things that we just looked at as positives that you could start with. But I would say that when you're correcting misinformation, it might be best to find something to agree with if there is anything, because that's fact-based. And when you find yourself about to correct or about to say, oh, no, or yeah, that's not right, or anything where you're going to say no, instead find one of these positives. That's what we call finding the yes. So the empathy, the validation, the agreement, and then say and. So if you say something positive and then you say but, that's precisely like saying no. So just practice.
This is, and I'll point out, this is a good one to practice with your partners or other family members as well. It's a skill that is relevant outside of reproductive
Absolutely.
health.
And I will say that this information sandwich you can use with any patient in any context. It has virtually nothing to do with sexual and reproductive health. It's just a little structure that will always work. So an empathy statement. Sometimes it seems to people like that's kind of challenging to come up with an empathy statement. And it really is simple. If you just realize that your job giving an empathy statement is just to let the person know you get it, you get that they're feeling this negative thing. It doesn't matter what it's called. It doesn't matter if it's anger, frustration, annoyance. It doesn't matter. It matters that it's negative or positive if it is, although it's a lot easier to empathize with positive. It's just important that there's an acknowledgement that there is a negative feeling going on, and that you care, and that you are seeing the person have that experience. And so instead of something like, you sound angry or you sound really anxious, it would be much better in terms of not having a little argument with the patient about whether they're angry or anxious, which one is it? Instead, just avoid all of that. Don't label somebody and just say, it sounds like this is really concerning to you. And it's the tone of your voice. It's the looking at the person in the eye. And it's just being vague about what it is, but not vague about how bad it is. Because you wouldn't want to say to somebody who had just said to you, I go to bed every night hoping I don't wake up in the morning, and I wake up every morning devastated to still be alive. And your response is, wow, that's tough. Yeah, that's not empathy. Or if somebody says, I forget to take my pill all the time, and you say, oh my goodness, that's so devastating. So you really have to match the level. And as I said, just the word wow will do a lot. Everybody knows not to say, I know how you feel, unless you're in a support group with them. So validation, as I said, I hear that all the time. I can totally see why you would think that. I hear that. My patient just earlier today was saying the exact same thing. I can totally get why people are saying this. So then the next piece is the bulk of the sandwich. It's the information, the content. And that content, as I said, can be just factual information. It can be clarifying information. It can be, so either new information they need, or correct information to correct something that was misinformation, or something that is just bringing the conversation forward. The way that we would bring the conversation forward, probably the most efficiently and the most effectively in terms of building rapport, is with a paraphrase, which essentially is not repeating back what somebody has said, but it's pulling out the essential pieces of what they've said and reflecting it back to them. Sometimes the gather technique is when you would take a fact or a piece of information from various moments in the visit, put them all together, like you've picked each one of these moments from a field of wildflowers, and then you put them all together into a bouquet and you give it to your patient. So that's kind of a way to think about a paraphrase as a sort of it can be a summary, it can be pulling out things that are critically important so that you're highlighting what's really critical to go to the next part of the conversation. So, just things like, I'm hearing you say you'd love a method you can forget about and can help with your periods. Is that correct? So you want, with a paraphrase, to start, again, it's like a sandwich. You start with an opening phrase saying that you're going to paraphrase, something like, I'm hearing you say, or it sounds like, and then you give the paraphrase, like, you're not interested in kids anytime soon. Do I have that right? Do I have that right, or is that correct? That is the follow-up question. So when it comes to paraphrase, you've got an inherent information sandwich, essentially. So when we are going to be using that center part of the sandwich to give information, as opposed to paraphrase, we want the information to be relevant to the individual, using plain language rather than medicalese. So finding a word that pretty much everybody will understand rather than the medical word, and limiting the amount of information at one go. You're going to have to give somebody all the information that they need, right, as much as possible, but you don't do it all at once. You do it in a small chunk, then ask a follow-up question. Also, using the patient's own words helps a lot, and using whole numbers like 5 out of 100 rather than 5%. Using visual aids, that's part of the content. Using tactile aids, that's part of the content of the sandwich. And then finally asking a follow-up question. So things like, how would that be for you? Has it ever happened before? How did you manage it? Do you have a sense of how you would manage it? So hopefully that structure and that framework, that structure can help when you ask these open-ended focus questions. This structure of an information sandwich helps you respond to those answers.